guys, welcome back to Medical Coding with Blue. Today's episode is all about from a GED or a high school diploma to a career in medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I get the question a lot. If you are a medical coder, does this mean you have to have a degree? And do you have to have all of this advanced medical education? The answer is no. All you need is a high school diploma or a GED, and you need to have completed a medical billing and coding program, or you could do self-study. There is always that option, but you do have to have one medical coding certification from one of the two major medical coding associations. There's the American Health Information Management Association and the American Academy of Professional Coders. These are the two major medical coding associations, and they each have their own certifications, but there's four that employers will look for. All you need is one. There's the CCS, that is the Mastery Medical Coding Certification. That is the Certified Coding Specialist. There is a CCA, that is considered the entry-level medical coding certification, and that is the Certified Coding Associate. And then there is the CCSP, the Certified Coding Specialist Physician-Based, which says that you have mastered outpatient coding. And these three are offered by the American Health Information Management Association. Then there's the CPC, the Certified Professional Coder, and that is a credential with AAPC, the American Academy of Professional Coders. Now, when you get the CPC, if you do choose to go with AAPC, the CPC will require you to have a apprentice status on your credential for the first 2 years of your working career, because this says that you are still new to the industry. However, there are ways to accelerate the removal of the apprentice status if you should choose to do so. However, it doesn't really matter because you'll get the apprentice removed in time. So it's not really something that is necessary to remove right away. Some people may say that, well, people don't hire CPCAs. They do. I'm a professional resume writer as well, and I have helped many CPCAs secure jobs just because I have rewritten their resume to show appropriately what they do, what they can do, and what they do offer as far as their skills. So that's just something that you need to know. But going into a career so early in your working life in medical billing and coding is a great thing. If I would have known about medical billing and coding when I was just out of high school, oh, believe me, I would have definitely pursued it because there's so much opportunity for growth. As an individual, as a professional, there's a lot of things that this career does offer. And again, you don't have to have a degree to get in. You just need a high school diploma or GED and one of the certifications. Now, the certifications take 9 months, 12 months, or 18 months to learn, to be able to prepare yourself to sit for one of those certification exams. There are accelerated programs out there, but I don't recommend those at all because it is so much that we do have to learn as medical coders, just the base knowledge that we have to have. Medical terminology, anatomy, pathophysiology. If you went to a high school that was concentrated on health careers and you learned all of that, well, you're already a step ahead. So that's always a great thing. If you have that extra knowledge, that's a wonderful thing to pursue. Now, this medical billing and coding doesn't require you to be around patients. So you won't have to be around patients. You won't have to have any kind of interaction with them. So that's always a good thing. This is an office job. This is a job that you're going to be sitting at a desk and reading a lot. So if that's something that you enjoy doing, well, this may be the career field for you. But it does take a lot of concentration, all right? But again, with all of the opportunities that are involved in this career field, the other thing that you should know, if you choose to forego going to college for a little while, right? And you say, well, let me go to a trade school, let me learn medical billing and coding, and then let me just find a job, and then, I'll think about it from there. The great thing about it is when you get into this kind of career field, oftentimes the employer will offer tuition reimbursement. And so that whole thing can be taken care of where you don't have to worry about ending up in student loan debt. So that's something that you should think about too. There's many other opportunities for jobs that you can go into that will, of course, pay for your education. Of course, there's the military, and there's a lot of other options as well. But medical coding is one of those little ones that people don't think about, because they don't really think about the fact that you would be working for a hospital, and oftentimes these hospitals have lots of money to educate their employees. It's all about asking the right questions and asking about those benefits. And most employers do have those benefits. So that's just something that you can really consider and think about before you put yourself into student loan debt. There's a lot of people that put themselves into debt with these college loans and things like that because they think that's what they need to do in order to get a high-paying career and to be able to make all of this money. But what they don't talk about is all of the student loan debt that they're saddled with. And you don't want that. I have always been a strong opponent of getting into student loan debt. There's many things that you can do once you've established yourself in this career field that can help you to pay for your education. So that is if you choose to continue your education into a degree program, okay? But that's further on down the line. This is a career that you can grow with, certainly, because when it comes to the opportunities that we have, you won't get bored because it's not the same thing. There are different specialties that you could code for. There's the emergency department. And the emergency department, you're going to see a smorgasbord of different specialties because people come into the emergency department with lots of different issues. Some is because they've had a stroke, they've had a heart attack, they've been in an accident, something like that, or they have a cold. And so you're having to look at the documentation and pick out the diagnoses, pick out the procedures that you see, and you're able to code those. Now, there's a lot of rules and a lot of things about sequencing, much more deeper than I could get into this video. But I wanted to just talk about the opportunity that is there when it comes to somebody who is just out of high school or just getting their GED and not really knowing what to do. If you can commit yourself to study at least for 9 months or 12 months or 18 months of learning from books, which you can learn medical coding from books. You absolutely can. That is one of the best things about this career field. And again, if I would have known about it right out of high school, I certainly would have done it then. I was in my later 20s when I started doing this, and I have enjoyed every single bit of it since then. Okay, so if you are a reader and you like to focus on things, it's one of those things that you can certainly do. This career field is very adaptable to many different personality types. And if you are a shy person, that is okay. If you're introverted, if you're extroverted, there is plenty of room to have different types of personalities in this career field. I am a shy person myself, but this career, I can say honestly that it has brought me out of my shell. I am very extroverted when I am talking about medical billing and coding, and when I'm sharing my knowledge, I get very excited because it's what I enjoy. And yes, it does make me a nerd, and I'm okay with that. I am totally okay with being a nerd when it comes to this, because the fact that I get to read documentation that's written by people who are incredibly intelligent, and I value intelligence very much, if you can't already tell. I do value intelligence. And when I get to read these documents written by these doctors, and I get to listen to them when they're talking, obviously, but really read and understand and comprehend what they're writing. And every year that I'm in this, I get better and better at it. And it's something. There's just something to it. It's very interesting, and I'm never bored because of it. The only part that bores me is, of course, some of the tasks that you have to do in your everyday work, but that's with any job, okay? But this, however, is not a job. Medical coding, medical billing and coding is not a job. It is a career. And once you have that moment where you understand that, and if you allow yourself, you will have that moment where you do understand it, and it's going to click, and it's going to be like, oh, now I get what she's saying. When you do have that moment, it's your aha moment, and that's when you're going to really start enjoying what you're doing. Not everything about it is fun in the beginning. Of course, learning it can be very frustrating. It can be a very lonely road because there's a lot of people that actually don't know what we do. And sometimes when you tell people, oh, I want to be a medical coder, or I want to be a medical biller and coder, they tend to try to talk you out of it. And they'll say all kinds of crazy things. But I'm speaking as somebody who's actually in the field and who actually does know. Because there's going to be people that think they know and they don't. And sometimes it's other healthcare professionals that think they know and they don't know. Some of my nurses have talked to me about that, where they thought it was this way, or the career to learn it was this way, and it was actually not so. And so they learned. They learned really quick when they decided to change over into a career in medical billing and coding. I do know somebody who graduated high school. He was a very early on viewer of my channel when I very first started the channel in 2018. And he graduated high school, got his medical coding certification. I helped him with his resume. He looked and he finally got a call for a job. And he has done very well since then. And he is now an auditor of auditors. And that's how far he's gone in his career in a very short span of time. This happened within 3 years. So he advanced quite quickly because he knows how to study and he knows how the rules go and things like that. And that's something that you can learn also, as long as you commit yourself to learning. And once you do that and you start to see all of the things that we as medical coders get to do, there's a lot of fun things we do get to do. We are our own community. There's a lot of us on LinkedIn. You can check out LinkedIn. I do have a page for Medical Coding with Bleu on Facebook. However, what I will say about Facebook is if you get into other Facebook medical coding groups, you may run into a lot of naysayers, a lot of negativity, a lot of people who maybe have failed the test, or they went through a fast-paced medical coding program and they were taken advantage of. And so you really want to kind of limit your time in toxic Facebook groups. You want to go into more positive groups. I keep a very tight rein on the comments in my Facebook group because I want it to be a place where, like my channel, where people come and they're positive and they have something to contribute to the conversation, and they are sharing ways of like how they study, and not just, oh, I can't do it and I'm so tired and I don't know all this stuff and I'm so scared. No. It's about, okay, we're going to get down to business. We're going to learn this. And guess what? I passed, or I did this, or I did that, or I, studied this way, or whatever. And so that's the kind of community that you need to be around. Okay. So that's just my advice there. Should you choose to get into this. But I will say that you must be committed. You must go through this with an open mind, because again, it's going to be a lot with the medical terminology at first. Medical terminology, anatomy, pathophysiology. The pathophysiology is about understanding the disease process and the sort of the symptoms that go along with it. But there's a lot of resources on the internet that are free that can help you to learn. Okay, so there's a lot of things out there, and you could just let your fingers do the walking. Okay, now you may have heard, oh, it's difficult to get a job. I can't get a job. No one can get a job. They can. A lot of times what happens is those people don't have a well-written resume. That's a big part of it. And then they want to get discouraged right away because they've applied for 2 or 3 places, 4 places, and no one is calling them back. When it comes to applying in this field, you have to apply at a lot of places, and you have to be very specific when you are applying. So that does mean changing the job title on your resume for the position that you're applying for. And it requires you to update your resume quite a bit, at least just the job title, but it's okay because for every interview that you go on and every place that you go, it's going to be that one step closer to finding your forever home wherever you start your work, so that's what it is. But don't be scared of it if that's something that you think that you might want to do. Some of the funner things that we get to do as coders also is we get to meet up in conferences every year, national conferences. One of my most favorite things to do is to network. If you are in a program that is approved, if you're with the American Health Information Management Association, you decide to get one of their credentials and you get a student membership, you get the student price to go to those conferences, which is really nice. I'm just saying. And you should take advantage of that while you can, because after you get your certification, that conference ticket price goes way up. But there's a lot of things you can do at the national conference. Of course, learning a lot when you go, which is one of my most favorite things, because you get to hear all kinds of great speakers. And there's a lot of, again, networking events. There's a whole exhibit hall where you get crazy amounts of free things, which is a lot of fun when you do this, because again, I've seen a lot of things that they gave away that was like really awesome things. And what I do with that stuff is I bring it back for my providers, and that's how I use that as a grab bag when I'm doing provider education, which I think is great. But there's a lot more things. My channel is dedicated to sharing the whole world of medical billing and coding in this career field, and how to get started and what resources to use. In the description box of this video, there's actually the independent study video. You can check that out. You can check the books out from the public library if you want to. You can go online to Amazon. You certainly don't have to click those links. I have the links for the affiliate links in the description box, but you can certainly check Amazon and see what books they have, so that way you know what books to get and study with those. And it's just a matter of just opening the book and off you go. But like I said, this is a great career field, and a lot of people get into it, again, from all different kinds of ages and stages. And bringing a youthful energy to this career field is really good, because as the older guard gets to retirement age, we're going to need people to replace those people. And so that's the thing that I always encourage anybody that wants to get into it. If you want to do it, go after it and do it. If you're a male, and a lot of times males will write to me and say, well, I don't know, because there's a lot of women, and they say it's a lot of women in this field. There is a lot of women in this field. It is woman dominated. However, I will say that nursing was once woman dominated, and now there's more male nurses. And I know quite a bit of male nurses. So that's something that it needs to balance out in this industry as well. So I encourage you, because sometimes that's what we need, is a good mix of people. And people connect with others in different ways. And so that's just something that if you're considering it, you shouldn't let your age get in the way. Oh, I'm too young, they won't hire me. Yes, they will. Again, if you arm yourself with your knowledge and you arm yourself with a good resume, you're off to a good start. All right. But don't let anything else minor like that get in your way. As long as you have that high school diploma or a GED, if you choose another trade, or you choose this trade, I think that's great, instead of getting into college right away. Sometimes people think that you got to get right into college right after high school, and I just don't believe in that. I don't think that that's true. I think if you get into college right after high school, sometimes you're going to pursue that career field that you spent all that money and time learning, and sometimes you may pursue it, and then sometimes you may get done with that degree and you never use that degree. And guess what? Now you're saddled with student loan debt, and you're dragging that anchor into your 20s, into your 30s, into your 40s. And you're dragging that anchor all that way because of a degree that you thought you had to have. And then when you got it, you just never used it. Instead of just picking a trade like medical billing and coding, working in it for a little while and seeing what it's like, enjoying the process in the meantime, in between time, and not having that pressure of like, oh, college, college, college. You're making a good living as a medical coder. Now, we don't talk about money and specifics on my channel because every place in the US is different. And I do not sell this industry based on, oh, you can make big dollars. Because I've seen some of these schools hawk some really ridiculous starting salaries, or let's say it's up to, and people look at that high number and they say, oh, well, I'll get that. And then they're disillusioned when they don't get that right away, because that's why it says up to. You have to work towards it. Okay, but it is a very good paying field, and there's a lot that you can gain from it. But if you start out this way, you're not going to have all of the student loan debt, and then you may end up working for a place that will pay for you to go to school when you are ready. And maybe you need a couple of years, maybe you need a few years, maybe you want to get in at 23 into college and, you know, work from 18 to 23, and then still continue to work. And then you'll be a little bit more mature to appreciate a college degree, and then your employer can pay for that if that's a benefit of your employment. And then you don't have to be the one saddled with all that student loan debt, because you don't have to be. When I see people that they're complaining about, oh, I got into student loan debt and blah, blah, blah. You put yourself there. You did. And you did because you listened to other people who are trying to set you up for success by telling you you need a degree. But if you don't know what you want to do, and most 18 to 19-year-olds don't know what they want to do, and even if they get done with their degree, doesn't mean that that's going to make them happy, because they have a fantasy of what they thought they wanted to do, right, when they get this degree. But again, if you just take your time and then you decide what it is that you want to do, and then you're in control of your future, and you're in control of the debt that you can get yourself into or keep yourself out of. Yeah. You can keep yourself out of that debt, and I would strongly recommend you keep yourself out of that debt, because I have been a very strong opponent of that student loan debt, and I personally will never get myself into student loan debt, because there's other ways of getting your education paid for that you don't have to worry about all that. But people don't want to talk about that. They don't want to talk about how the employer can be the one to help them. Okay, so that's something that you should consider when you're thinking about pursuing a different career field. Don't let anybody talk you out of it. If this is something you decide on doing, you watch the rest of my videos and you see and you listen to my words, so that way you know what this career field is, because I share my views and I share the information on my channel freely, so that way you all understand what you're about to get into. Don't let me scare you. Let me prepare you, rather than you just running around just not really knowing what to do. This can give you a lot of discipline and a lot of guidance if you let it. Because being a medical coder is a very disciplined field. You do have to be disciplined because you have to study and you have to go over all these things. But I think that investment in starting a career field right after high school, right after getting your GED, and getting your career going into a career that you can branch off into other things when you're ready, I think that's a good deal. But whatever you choose to do, best of luck to you out there, whether you graduated high school and you just want to find a trade school and do that. If you got your GED, a GED is a great thing, guys. Even though everybody says, oh, you should get a high school diploma, everybody's education journey is different. And there is not the stigma like people think that there is with that GED, because high school is not for everybody. And sometimes people that are in high school, they're just too smart, and a GED is a better option for them. Or sometimes it's just high school is just so hard. It's so hard with so many personalities and things, and it just, the world is just a different place now. And so sometimes getting that GED is the best thing for somebody that is going through a lot in high school, and it's really unnecessary. And giving them that opportunity to get that GED, pursuing that GED, and getting their certificate, and just being able to start out in the working world, I think that's a better option, because at the end of the day, it is your life, and whatever it is that you choose to do with it, every day is precious. Every day is your investment in yourself and the rest of your life and what you're going to do. And you want to have good experiences. I get it. But at the same time, do what is right for you and make that decision for yourself, because you don't want to be a miserable person and stuck with debt. And you are just like, what do I do? When you can do it this way, when you can finish school or get your GED, get into this studying medical billing and coding, get your certification, and then you get out there and you the world is your oyster. Okay, so with that said, I'm going to wrap this one up. Thank you so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.